That is how I do it.
Total
If I were to do,
session.
yeah, if I were to do only pixel, then I would do it once in a month. So you'll feel some pricky sensation. We press the, you're doing 4 stacks. 1, 2, 3, 4. 1, 2, 3, 4. Are you okay?
Yeah.
She's fine. She's a tough woman.
Actually, I had my derma roller treatment done.
Sorry?
I had.
Vacuum evaporator you might require for this. Zimmer is generally not required. If you have Zimmer, wonderful. Then you don't require the local anesthetic also.
This is for 49 dots, no?
This is for 49 dots. That's the deeper one. That's what we use for acne scars. Each pulse would go in about 150 microns under the skin. These are all box scar kind of scars that she has. Some ice pick scars are also there. She should improve decently with about 4 or 5 sessions of the pixel laser for this. Now you can see that if you look at the counter, the pulse counter, just focus on that please. We are firing so many pulses, but the counter is only counting this as one pulse. Till the time both the foot switch as well as the hand switch is pressed, it only counts it as one single pulse. That comes in handy because the company gives you a warranty of 2 lakh pulses. Yeah. So in case you have some problem, you have difficulty before that, they'll change it for you. I think or whatever they'll improve, make it okay. So I do pixel fairly frequently. I've only utilized 400 pulses till now in the last 2.5 years. Are you okay? So after half an hour or so, it starts to get getting a little burning sensation, which will also last for an hour or so.
What care should I take?
Still, you please take. The care that you have to take is primarily sun protection and not using any harsh soaps and face washes for the first 24 hours. Things like swimming and physical activity in which you sweat quite a bit should be avoided for 48 hours. Applying moisturizing cream and probably a topical antibiotic would be a good idea, especially in this humid weather, where chances of very superficial infection could be there, even though that's very, very rare. So you can cover the entire face in one pulse only.
And after how many days she can start her own topical treatment like topical retinoids or anything?
As soon as the scabs peel off, once the scabs peel off, the underlying skin is not pink in color. It's whitish in color only. She's able to take 4 stacks over here. One can go deeper also, but
So this much is enough.
this is okay. We don't want any post-inflammation. This is fine.
Stacking is what, sir?
Stacking means you fire pulses at the same point. You place the handpiece on the skill, fire 4 pulses at the same time. So it means deeper penetration would happen. Somebody who has deep scars.
You are doing 3 stackings here.
4.
4.
She has amazing, I think, tolerability, I must say. Getting worse now, very painful. We're about to finish. We'll just do the forehead area a little bit. 3 stacks. We'll do the scars are not that deep, so we'll do about 3 stacks only there. As you can see, you can cover up most of the face in about 5 to 7 minutes. So it's a fast treatment, even with the stacking. Generally for face rejuvenation, we don't do so many stacks. We probably do 2 stacks and then we rotate the handpiece by 90 degrees and try to cover as much area as possible. We want very superficial abrasion to happen on almost the entire area. Okay.
Yes.
We're almost done, sir.
Then
will fall after how many days? 7 days.
7 days. You have to apply sunscreen very religiously during that time. So now it counts one pulse. You can see from 1 it has turned into 2. This seems like a very new handpiece. So overall only 5 pulses have been used. You remove this. The treatment needs to be followed with a lot of cold compressors and antibiotic application and sunscreen application. Fine. Okay. With topical anesthetic, most people try to use that. It becomes very comfortable. There's only that slight burning sensation that takes
Yeah,
place.
there is some.
There is not. It increases. When you start the treatment, it is not there. Cold compress, cold compress.